Every day we face hurdles in our life and problems that require new approaches or breakthrough innovations. In this podcast series, we're going to meet people that take audacious swings for the fence because they believe that changing the game is their personal responsibility. They believe it is up to them to be the solution. Hi, I'm Mark Forche. I'm the President and CEO of Delphinus Medical Technologies. Welcome to our Be the Solution podcast. We have a really exciting topic and a group of participants today. And of course, this podcast is focused on innovation and how we address challenges and how we find solutions. And as I think about dense breast screening in that process, there's really three groups of participants in a screening event that play vital roles. Of course, the patient and the role they play. Radiologists, as they read the images and they see the outcome of the scans. But the technologists and the people that directly match the technology to the patient to acquire data play an incredibly vital role, not just in capturing the data, but in also providing insight to how an innovation can be properly optimized to deliver its very best work. And the people that we have here today have done some incredible work in developing the SoftVue technology as an innovation. And I'd like to welcome Lisa Bay Knight from Karmanos. Lisa is a research nurse that has worked extensively with SoftVue. Vivian Link is a clinical research associate, also at Karmanos, and extensive work with the SoftVue technology as it evolved. And then Jen Granadaria, a technologist at one of our research sites. So thank you all for being here, and thanks for the work that you did in this study. And you played a really vital role in optimizing the technology for dense breast screening. So maybe let's start with this. So each of you found your way into women's health, into breast screening. So what inspired you to focus your career on this specialty and this work that that you've done? Maybe Jen, we'll start with you.
So where I work, I actually started at the front desk.
Wow.
And then, yeah. So I started at the front desk, and then an opportunity in the research department opened up, and that's how I started in the research department.
Wow, awesome!
Yes.
And that's a cool pathway to get there. Lisa, how about you?
Well, I am a registered nurse by training. I've started my career in clinical research 1997. Almost half of my career was in pharmaceuticals, and then I transferred over to device studies, hired in at Wayne State University, working on mammogram related device, and then I collaborated with Dr. Neb Durick and Dr. Peter Littrip on this wonderful technology that we're discussing today, SoftVue. I became their research nurse about 16 years ago, and I've seen it from infancy to FDA approval.
Yeah.
And it's been a phenomenal experience. I love women's care and working in disparities. I work in Detroit in the urban setting, and I just think this would be an awesome technology to not just impact women, but minority women as well.
Yeah, fantastic.
Yes.
And you played a really interesting role that we're going to talk about in a second. Love to talk about that. And Vivian, how about you?
Well, I came originally from the automotive industry and left that field and went to Karmanos. So I started working back in 2010 at Karmanos, and then about 2012, I spotted this lady going by, and I got inquisitive as to what she was all about. So I found Lisa and found the SoftVue device was in its very, very early stages, and became very interested. And it's a personal interest for me because I am a breast cancer survivor. This year, 17 years. Thank you. Thank
Awesome.
you. And so I have come full circle from being a person that worked in the breast center to also having breast cancer myself and going through all of that. And my mother was a survivor, and my sister is a survivor as well. So the finding breast cancer early and detecting it, hopefully with this device,
well,
is going to be
number
awesome.
one. Very appreciative you shared that part of your
Oh,
life
absolutely.
and your journey,
Yes.
and that's exactly
Thank
why
you
we
so
all
much.
do what we do. My mom had breast cancer. I was in ophthalmology
see?
for 30 plus years, and I came to this to pay a tribute to my mom.
So kind of full circle for you too.
So absolutely, and that's why we do it. So let's just take a second and dense breast screening seems to clearly be an unmet need for new technology to address some things. And you've had different experiences. Let's go back before SoftVue. And what things, when you looked at available technologies, were the challenges that we needed to find solutions for? Because this technology was intended to address them. So what things did you look at and say, wow, this could be done better? Jim, maybe start with you, because I think you work with a lot of stuff.
Yeah. So we had the A-bus.
Yeah.
That had a lot of hinders. A lot of stuff that started with that is the pressure that you put onto the patient. So onto the chest. So A-bus is an ultrasound where the patient is laying on their back, and then the ultrasound is put onto their chest. So, and then from there, it's pressure, pressure, pressure. So a lot of the older patients can't have that pressure onto their chest. A lot of patients that can't have that pressure onto the chest. So that you can't do it on a lot of population of patients. You also have MRI. That is not good for patients with dense breasts, and there's also injections. So you have injections with MRI, and a lot of patients don't like the needles. You also have handheld ultrasound, which is also good, but it also takes a very long time to do that. And it also is a person that does it. So you have all these patients that need to have that, but you also have a person that has to do that. So it backs up patients. So that exam itself takes about maybe 15 to 20 minutes to do. So if you have maybe 20 patients that have to do it, that need that exam, it's one person that does it, and that's a full day of patients. So 20 patients for one person to do. So
So a lot of maybe room to see things that could address some of these challenges. Vivian, Lisa, anything you'd add to that?
Well, I would add, I'm not a stenographer or a mammographer. My own personal experience with mammography itself is a necessary discomfort. One of the most common things we hear from patients, and even in our research studies, is there a better way to screen my breast without the compression, without the radiation and the discomfort? And then when you have the challenge of having dense breast, which on mammography, the dense part of the breast is the fibrous breast that looks white, and the fatty tissue looks dark. And you can find things in dark backgrounds because cancer on the mammogram may look white cloudy. And when you have dense breast that's white cloudy, you can potentially miss cancers in the breast. So that's a challenge from mammography, for mammography, finding potential cancers in dense breast. We know that ultrasound doesn't have that challenge because we can find masses in dense breast tissue. But as Jenny spoke earlier, she stated that ultrasounds, whole breast ultrasounds are it takes a long time to do one breast, let alone two breasts, and is operator dependent. So you're depending on the operator to acquire a very thorough exam, and it can't be replicated the same way all the time. But that's a problem that we have to address. And SoftVue being the solution to that, you can acquire this, replicate the same image of the whole breast with SoftVue without the variation of the operator by just properly positioning the patient and pushing the button. And so it only takes less than 3 to 4 minutes to acquire a scan of each breast with the SoftVue. And that was a solution to a problem that we had with screening, especially women with dense breasts. So, and as you mentioned, the MRI, it's time consuming, it's invasive because you have the contrast. And then some people have phobias, and it's harder to manage them to lie still for 45 minutes.
It's loud.
It's loud, and it's very expensive.
Yes, it is.
One of the advantages of ultrasound is that we could probably still have the same billable codes for a regular ultrasound, but you get a more thorough exam from the radiologist's point of view.
Yeah, I think so. One of the things that you're mentioning there's interest in other modalities. Why? So it's probably because there's an unmet need that needs to be satisfied. Everybody's looking for a better solution. So I think that's clearly what this was intended to be. Vivian, anything you want to add?
Well, I just want to stress that because there's no compression and there's not radiation involved, which we all want to avoid radiation. I mean, going through cancer myself, I certainly don't want to be exposed to any more radiation than I have to. And time is of the essence. People don't have time. We have so many people with busy, busy schedules. So if we can get this patient in and out within 20 minutes for the whole thing, they're going to come back to us. And people aren't going to be hesitant about doing their annual mammogram. They're going to come back and they're going to follow through on their health. You know, they're going to take care of themselves.
And that's a really key thing, I think, for us to think about. There's 38 million women in the United States alone that would be in the category of dense breast patients if you just kind of look at the data. And about half of them don't get screened. So, so there's a real need, I think, to try and address that in an appropriate way. So, Jen, I think it's really remarkable. I mean, I love that you went from the front desk to this incredible development project. But you did not have a specific degree or license to do that.
I do not.
SoftVue doesn't require that. That's I think a really key thing that enables somebody like yourself to do this. And other technologies, I think you experienced as a patient, right?
Correct.
Yeah. And so how did I mean, that was probably pretty remarkable to enter a study like this. Any comments on or thoughts on that?
So being part of a research team with this type of study, we didn't have to rely on anybody else in our building. So no mammogram techs, no sonographers. It was a research team. So we didn't have to have anybody else pulled onto the study. It was all us. Because I was able to go downstairs, I was able to recruit the patient, and then I was also able to scan the patient. So from start to finish, it was all me or one of my counterparts. So it was all us.
Well, so I mean, that's another remarkable solution to a challenge. You know, a lot of times you have a brand new technology that requires some really specific, detailed training and certification or licensure to be able to do the data acquisition. So that's really cool that it allows you to do that and participate, and great for the practice too to be able to have you do that and in advance what they're doing on the research side. So fantastic. There was a point in time at which the first SoftVue prototype. So you guys didn't. I mean, at that time it was Dr. Durick and Dr. Littrop that created that prototype and came in, and I don't think it was the prettiest thing in the world.
No,
but
it was.
it
Took
had,
up half a room.
it had some,
It was
had some really novel core technology that was intended to address some of these things. And when you looked at it and thought about it from a patient scanning and positioning standpoint, what kind of things? So there's a lot of new things here. So water, there's a transducer ring, there's a positioning the patient appropriately to address the transducer ring.
Right.
What kind of things did you think about in guiding that patient the right way?
You go ahead, Lisa.
Well, seeing the evolution of the SoftVue system, initially, the positioning was very simple. Basically, the patient lied on the bed. They placed their breast, the stomach down. They placed one breast at a time in the opening on the pool of warm water, and there was a circular ring. So it was pretty easy to position the patient, making sure the patient's breast wasn't touching the ring. The issue wasn't the patient's comfort or positioning. It became an issue when we would gather the images and the breast would move. So that would cause imaging artifacts, and it wasn't the best quality initially for the radiologist to read and interpret. So we had to come up with a way to also don't take away from the comfort of, and the time and the comfort that the patient experienced in the positioning, but making the breast more stabilized so it's not moving. And that evolved around 2016, I believe, 2016, before we did our multi-center clinical trials. So with that, we found that the radiologists were more satisfied with the image quality. They didn't have a lot of artifacts. There was this nice little, they called it the secure breast interface, which was a coupling for the nipple and breast. And it helped to stabilize the breast so it wasn't moving in the water. And also for our women with the smaller breasts, it helped to gently elongate that breast and get a nice shaping, so the radiologists can get a very nice reading. And it improved the quality of the images so much better. And in terms of comfort, the patients, the majority of our patients would say, "Oh, I would do this any day over a mammogram." There's no compression. It's very comfortable. You could hardly feel the suction that helps hold the nipple in place. So I love being able to follow the evolution into to the point of FDA approval.
Absolutely.
So,
it's been a fantastic ride.
Well, I think what you've just spoken about is one of the things that is really essential in solving problems in technology. So those things that you described, the breast moving, not being elongated, the resulting artifacts from that, those are challenges that have to get communicated critically to a company to be able to seize it and then give it to the engineering team and say, now figure this out. So this podcast is Be the Solution. That was a massive challenge to say, how do you do that? How do you maintain patient comfort? How do you deliver consistent imaging in a way that that enhances the ability to see the cancers in tissue? And so secure, I mean, I then had the just incredible seat to be able to watch how this all unfolded in developing this technology, and it was transformational. So transformational in that it was technically essential to deliver these great images, but those things don't happen unless you have people defining problems, defining challenges, communicating them appropriately, and then a company has to have an ear to listen and not say, "Oh no, you're doing it wrong." To listen to those things and then take that information and respond appropriately. So I mean, the things that each of you have said have been really, really key in what went into developing that. Any thoughts that you have on this, Jen, or is just?
No, I mean, the patients then never had an issue with that. Patients were great. They loved it.
Yeah, absolutely. So I think kind of the whole pendulum breast. I know when I sort of entered Delphinus, and I heard long ago there were some water bath approaches, and the pendulum breast was really a key issue. I think we solved that, but we solved that from great introspective process and combining feedback with technology and engineering approaches to do it. So then we launch into a study, and you enrolled patients. Maybe just tell me a little bit about the process of enrolling a patient, or I'm not enrolling a patient, but scanning a patient. What things really strike you? Because each of you cited things that you thought were problems needed to be solved. Maybe Jen, I'll start with you on this. When you think about scanning a patient, what are the key pieces that you that you instructed them to do and kind of took as your role?
Yeah, so we would have them lay on the table, step up and lay on the table, one knee up, one arm up. We would get them onto the table, make sure that they were comfortable. We would press the button and pretty much the machine would do it themselves. It would do everything itself. We would, instruct them to lay there, be quiet, breathe normal. And these patients would literally fall asleep.
They do.
They do. They fall asleep.
Some snoring.
After it's done, it kind of lets it go, the breast go. We would kind of say, okay, this breast is done. Let's go to the next one. They would kind of switch positions. Next knee up, next arm up. We would get them into position. We would press the button again. And again, they would just very still, very quiet, and they would just relax. And then when they were done, they would dry themselves off, and they, this is great, this is awesome. And it is a self-cleaning tank. You press a button, and the water drains, it cleans itself, and next water batch comes in, and it's warm, and it's ready for the next patient. So, I mean...
Awesome. Now... So you mentioned the position of the arm, position of the knee, and so those things were not immediately known how to do that, and I think you guys played a really important role as optimizing patient positioning for the. So any comments on that? How you learned?
We can't say one size fit all because women, we're diverse. We have smaller breasts, larger breasts, and you have to position them accordingly. So the standard is like Jennifer said. You would lift one arm up and one leg up and make sure the breast is not touching the ring, and make sure the nipple makes contact with the secure interface, and that there's a nice elongation and positioning of the breast before you push the button like you stated. And the system scans the breast itself. We just make sure that it's positioned properly and push the button, and it's done in about 3 minutes. The nice thing is, I've even had patients like, do I have to hold my breath? No, not for 3 minutes. We're not going to do CPR on you.
No CPR.
But the nice thing is you just breathe normal, just relax. And most patients are so ecstatic about this type of technology. It doesn't take all day. They undress, remove their jewelry. We scan them from. Usually, they can wear their undergarments. Their from the waist down. We provide a nice little either a gown or a cape, and it's very discreet. And we scan, once we position them, we scan them. And like you stated, they dry off. We make sure they get off the table safely and they're good to go. And the scanning process itself, from the time we get them on the table and off, is about 10 minutes. 10 minutes. Like I said, the patients are very comfortable. Most of them have very positive things to say about the process, especially for women who have experienced a mammogram or maybe an MRI, even a handheld ultrasound, which is the standard for adjunct screening on dense breast for mammogram patients. So this is a very viable, awesome alternative to handling patients with dense breasts. And you said 38 million. That's like, that blows your mind.
Huge number.
Now they have an option.
Requires automation. Requires something. Yeah.
Yes. Now they have an option.
Yeah. So we know, based on these processes, that it delivers consistent, repetitive, fantastic imaging, and we see the output of the data, the PMA approval, improvement of sensitivity, specificity. I mean, so that's all super impressive. But one of the things that was really critical here is ensuring that in this scan process, patients had a exceptional experience. So maybe just your comments on what you, as directly interfacing with patients, what you hear and what you've experienced in their feedback to you through this process.
Oh, so comfortable, so comfortable, so easy to do. All ages can do it. I mean, it doesn't have to be that 40-year-old, it can be that 80-year-old, We're very flexible. We work with the patient. We've even had patients come in, that are on oxygen or have had a broken foot or whatever. We have gotten them up on the table safely, scanned them, got them on their way.
I would say the number one comment we get, especially after the patients experience SoftVue, when will this take the place of mammography? And we have to explain to them it's not going to take the place of mammography, but it will help enhance the ability for us to catch cancers early on that might be missed by mammography. And with 38 million women that have dense breasts, I mean, that blows my mind. And just a few years, I think in 2016, Michigan got the mandate to inform patients. It's by law, they are informed that they have to be notified they have dense breasts. A lot of women didn't know what that meant. I didn't know what dense breast meant until I started doing SoftVue. And I didn't realize it was a challenge with mammography until I started working with SoftVue. And there's your problem, and here's a solution. All of us have a mother, daughter, sister, auntie, girlfriend, someone that has close to us that has experienced a scare. I have. I've had a couple of biopsies, and I was scared to death that it might come back cancer. My beloved here, she experienced that, and thank God she's 17 years survivor. And I know, and I have family members who have had breast cancer, like you said, your mother. And I'm hearing, and it's, to me, being an African American woman, knowing that we are the most likely to, we might be diagnosed the same as our counterparts are white women, but we die the highest in this country from breast cancer. And for the number of, we're in the urban setting, for the number of women that come through our doors, majority of our study patients are African American women, which is rare, that we would participate in research. But their number one thing is, I'm scared. It's painful. I don't want to do this. And I hear it from all women, but it really, to see that we can have something that would address disparities as well.
Yeah.
it just warms my heart.
So Vivian, as a survivor, I know this is personally so meaningful to you to work on this.
Yes, it is.
But I also know from conversations we've had that one of the things that really impacted you, and it was kind of one of those watershed pivotal moments for us
Yes,
as
it
a
was.
company was the very first patient where we found a cancer that Mammo had missed in the study, and it was a really touching moment to all
Right.
of us.
It brings tears to my eyes now.
What are your thoughts
Yeah.
on that? Because I know
Well, as a cancer survivor, finding that mass on an ultrasound on SoftVue, this woman was a volunteer into a study that
Had no idea.
Had no idea.
She's screening.
Yep,
Screening
a screening
mammography.
mammography. And we happened to spot that cancer
That was missed.
and get her the care that she needed to prevent that cancer from spreading.
Early detection.
Possibly from losing her breast or worse, her life. I mean, it just touches your heart.
well, she was quite vocal about
Yeah.
the life impact that had for her.
Yes.
And so meaningful to us as a company, and meaningful to me personally. Wanting us to achieve something really impactful here. Her quote is on a picture right outside my wall. Every
Right.
person that walks in my office sees that quote,
Yes.
and that's why we do what we do.
Yes.
That's right.
Yes.
And that's why we do what we
Yes.
do.
Yeah.
Women today are used to having, the mammogram,
Yeah.
the ultrasound, but we want to help future women, our younger women,
Yeah.
and make them aware of our technology.
Yeah.
Get that out there.
Well, I think to me this opens up a whole new pathway for
Right.
for patients. I mean, they have a whole new approach as a dense breast patient,
Right.
to satisfy when the confusion when they get the dense breast letter and they say, "What do I do?" Well,
Right.
actually, they don't even have to come back another day. They can do it that day with SoftVue. That's what the
Exactly.
indication allows. And so all of that helps address those 38 million patients that
Right.
do get scanned and that should get scanned. It makes a big difference in
Right.
all that.
It's interesting you mentioned that about the women. The reason why women start screening around 40 years old because of the radiation.
Right.
With SoftVue, there is no radiation. So if you have a history of breast cancer in your family and you have women who are dense breast, I'm a mother. I want my daughter, who's 20 or 25, to start getting some type of screening assessment. So she won't catch cancer before she's have a cancer before she's even able to get a mammogram.
Exactly.
We've had volunteers in our studies, young women. We had one, I think two women that were under 40, African American women their cancers were found, one during her pregnancy, and she was late stage pregnancy, so she had to hold off her chemotherapy treatment till the baby was born. And the other one, she was newly married, and in her early 30s. So there was no way that her cancer would have been found yet by mammography because she wasn't at the proper age. So this gives women especially with history in their family, the opportunity to start their screening sooner without that radiation exposure.
Yeah.
Right.
Well, it's rewarding to
Yes.
hear that.
Yes.
That's why we do it.
Yes.
So all those reasons are why I think we need new solutions. Why we worked all so hard to get here. I'd just like to say to the viewers, I think this is an exceptional example of how individuals involved in something can make such a difference. All of these women that participated in this study and development of this technology, their feedback company being able to listen to things carefully, all of that really resulted in an incredible outcome. But it's each person staring at a challenge and saying, we want to be a solution for that challenge and developing an innovative approach to do it. That's what this discussion is all about. Thank you so much for joining us. Watch for future episodes, and we look forward to seeing you again.
Thank you.
Thank you.
Thank you, Mark,
Awesome.
for having
Thank you guys
us.
for being
Thank you.
Thanks.